Thank you so much for joining us on today's episode of Hello Life. We are pleased and honored to have our guest today, Dr. Amak Mitra, who's had extensive work not only in our community, but in other nations as well. Dr. Mitra, thank you so much for joining us. Tell us a little bit about yourself.
Thank you for inviting me. I'm basically from Bangladesh, where I did my MD, and then in this country I have done my doctorate in public health. Currently, I'm a professor of public health at Jackson State University.
So I wanted to talk a little bit about what is going on in the state of Mississippi. Let's talk about some numbers we're currently experiencing in relationship to other regions. Like, do you believe that this is the root of the issue with Mississippi if we're talking about, let's say, nutrition and activity?
Yeah, the major public health problems in Mississippi, I should say heart disease, obesity, diabetes, teenage pregnancy. We are number one in the nation. That's not good. So when I go into the root cause of all these problems, I want to say that obesity is the major cause of all these chronic diseases. If you connect with heart disease, if you connect with diabetes and other chronic diseases, osteoarthritis, all these problems are due to obesity.
Studies are showing that the vast majority of chronic illness that faces our state and the population is what we call preventable, meaning that we can change this direction with a change in our behaviors. But it sounds like, Dr. Mitra, you're saying that these things are all interrelated and connected in some way.
Exactly. I always believe that many of these diseases can be prevented, such as heart disease. If we take two major preventable causes of heart disease, one is your obesity, the other is smoking. Okay? And so, if we can prevent those diseases, we can prevent heart disease. We can, if we prevent obesity, we can prevent diabetes also.
So talking a little bit from the preventable side, given the fact that the top health risks that we face are preventable, where does just say one start?
We all know that obesity is the cause, but it's hard to tackle the problem because we need to work together with the society. The providers, the patients, the society, all together should work to tackle this problem. Changing people's habit is not easy. You need to really work hard to work with them, to educate them. Sometimes we public health people offer them some health fairs. We invite people to health fair. We offer them some services such as we can measure their blood pressure, we can measure their blood sugar, body weight, and also give advice.
I think it's just about what we all were talking about with community. We want to start with the community and get everyone involved, and I think Patrick and I were talking earlier about getting public schools involved and teaching kids at a younger age about health, motivating them with activities and different things, different outlets that they can do at such a young age.
I think that's a very good idea. We need to start our education for the kids, because if the children get the habit, if they're in shape, they can prevent obesity when they're adult and get many diseases out of their risk.
Right. So clearly the prevention piece in this equation is extremely important because it's so empowering. And yet to address this in a community standpoint, I think Dr. Mitra, excellent suggestion of bringing people together, but then also providing them with the direction they need on how they can improve the health of themselves and their family.
That's great.
Absolutely.
Yeah. Well, Dr. Mitra, thank you so much for joining us today. Thank you for your input and your guidance. And we encourage you to continue to watch and take the time to take care of you, and take the time that'll allow you to say hello, life.